Hi everybody, it's Dr. Cole. Today I want to talk about low thyroid conditions and how it relates and how we see it in functional medicine. 27 million Americans struggle with low thyroid conditions, and it's estimated that over 13 million Americans go undiagnosed every year with low thyroid issues. Well, in functional medicine, we not only look at the labs that are run in the standard model of care differently, but we also run different labs to look deeper into why people are struggling with the issues that they struggle with. So let's look at why we do this first of all. Well, the scientific research, what we see in the research is that there are 6 different reasons why somebody can have low thyroid issues, but only one of those reasons responds effectively to thyroid replacement hormones, or Synthroid. So there are 5 different dysfunctions of why somebody is struggling with low thyroid symptoms that will not be helped with Synthroid. So we have to look at these other 5 different reasons that are falling through the cracks, that are not effectively being helped in the standard model of care, but are given Synthroid and just told to live with it. So we have to look at the scientific literature and then apply it in our clinics, and that's what we do here all across the nation through our virtual clinic. So we look at the 6 different reasons of why somebody can have low thyroid symptoms, and then beyond that, the details of it is that there's 22 different patterns within those 6 that even makes it even more complex. So we have to really look and tailor it down to the patient's own individual unique biochemistry, and it's going to be different from patient to patient. The idea that a one-size-fits-all approach is going to help patients is obviously not working in the real world, and it's illogical even just thinking about it firsthand. So we have to look at why people are struggling with these issues, and when we look at the labs that are run, and normally it's just a simple TSH, and then that's the gold standard for whether or not you should be on Synthroid. The fact of the matter, the other 5 different dysfunctions of why you're having these symptoms, you can have normal TSH levels but still have all these symptoms that are classified as low thyroid symptoms. So if you do a Google search on low thyroid, you look like this is you. This really resonates with you, but your TSH is normal. So we have to look beyond that TSH and find out what is going on with you. So we have to look at brain function, we look at adrenal function, we look at gut function, which I made other videos for these different systems in the body, and we look at other organs and endocrine systems that help or regulate your hormone production. So we have to order the right tests that are not being run today, and that's what we have to do in the clinics to really get a comprehensive diagnosis. But we also have to look at the labs that are run, the normal TSH, the normal blood labs, and look at not only the pathological ranges or the lab ranges. That is where a lot of doctors are missing the point here, is that when your doctor tells you you're normal, he's telling you you're just like a lot of other sick people, because how they determine those lab ranges on your lab that you get through your PCP or your endocrinologist is just an average of the people who went to that lab throughout the last year. So the people that are going to labs are typically people that have symptoms, that have problems. So you're just getting an average of a lot of sick people. So we have to look at the functional range, which is much narrower, and it's been well researched to show what is optimal health, what is optimal thyroid function, hence the term functional medicine. So we don't only have to interpret the labs that are run properly and differently than they are being interpreted, but we also have to order labs that are not being run in the standard model of care. Only then will you get comprehensive diagnosis and real solutions for people that are struggling with low thyroid symptoms. So if you want to learn about low thyroid and about functional medicine, check out drwillcole.com, check out the Facebook page, check us out on Twitter, and I put all the links here on the YouTube channel so you guys can learn more about this and see if we can help you. Have a great day.